time it is. Marvin Devine, Hoover, Axel, and you know how we do.
Yeah, I got the juice. Whip game cool, make them look like cool. Always play it cool, that's the biggest rule. Forget what they doing, keep on doing it. I've been making loot since like 22. Ask me how I made it right here in the booth. I'm always pursued cause of what I pursue. That's greatness, yeah, I gotta make it, I got things to lose. Boy, wanna get in my crew, but you can't get in my crew. Me, XL and Hoover, way too fireable. When this joint drop, better call the troops. And when you hear the drop, better raise the roof. Better raise the roof.
You already know what happens when we link up. Let's go.
Yeah, I got
Good afternoon and good evening, and welcome to another edition of Kidney Hub East Africa. I am half your host, Steve Belcher. Before I bring my colleague on from Nairobi, Kenya, the kidney ambassador, Moses Kennedy, I'd just like to say it's unfortunate that let me see, on TikTok, it's maybe 17 people, but on YouTube and Facebook, there's no one, I guess, watching at the moment. But that's unfortunate because we're about to talk about something, a topic that impacts more than 14,000, but more than that. That's how many people, 14,000 bloodstream infections occur in patients on dialysis in the U.S. in 2020. Now we're in 2023 and the numbers are going up. More than 1 in 3 were caused by staph infections. And we have a lot of people on dialysis. Make no mistakes. Thousands and thousands, in fact, hundreds of thousands. And a lot of them had these catheters. But we're going to talk about not just that, but infection prevention, what you should know. Let me bring on my co-host live from Nairobi, Kenya. Let's give him the co-host welcome. Brother Moses, welcome. How are you doing? Unmute your mic.
Yes.
There we go. How's it going, Brother Moses?
Steve, without lying, anyone suffering from CKD, especially kidney failure, it's never been good, but you must keep on going.
Well, Brother Moses, let me stop you. We couldn't hear you.
Yes.
From the beginning. We couldn't hear you. So first of all, how are you doing?
I'm doing great, Steve. Do you hear me?
Yes, now we can hear you.
Yes, really doing great today, more than any other day. I don't know why. I look full of energy, but kidney failure and dialysis is no joke. This is why we are talking about this serious subject that I want to encourage all who are watching. Don't go away, please. Stay hooked on the screen. At least the life you save today could be your own life.
Oh, absolutely.
Yes.
That was
me,
one
Steve?
of my sayings. The life you save may be your own. And you never know.
I borrow it.
Oh, you borrowed it from me.
I borrowed it from you. Yeah.
That's okay. That's okay. But serious, Brother Moses, let me just go over some statistics. And I know this is just here in the United States. It doesn't reflect globally. However, if it's this bad here, then we can make the assumption that it's even worse, maybe where you're at, or other parts of East Africa, or even other parts of the world. Now,
very true. It's really was here. Very true.
Now, listen to this. Here, one of the most serious and life-threatening infections in dialysis patients is septicemia. Now, you may have somebody on here watching like, what the hell is septicemia? Who just started dialysis. It sounds like some big technical medical word that someone would be like, I never heard of it. I don't care. It's not impacting me. But that's far from the less, because if you're on dialysis, okay, and if you have a catheter or an access in your arm, any insertion at any point where you got to put needles in your arm or something's going in your body, that's opening the door for an infection. Now, Brother Moses, you can speak personally on that because you have a catheter. Is that correct?
Very true. Correct.
Now, have you experienced an infection?
Oh, yes. Recently, this year, in fact, for the last 6 years, I haven't experienced infection. But this year, I've experienced twice infection and been hospitalized twice. So infection is something that we must watch out. And we patient, both the patient and the healthcare providers must also watch it. But however, the most important thing that as a patient, you really need to be part of that team, not absolutely part of that team. Yes.
Okay, so brother, showing my followers on TikTok that was watching is the type of catheter, without you having to show it, that you may have something similar to this. Okay, and this part right here, from here all the way to this part, goes under the skin, and the tip rests in the back chamber of the heart. Okay, now when you have something like this going under your skin, you have to be very, very careful. Not just you, the person that has the catheter, because 9 times out of 10, most people who have this don't even touch it. They don't touch it because, excuse me, they don't really know nothing about it. Just like if you had an implantable device, something for chemo or whatever, 9 times no one is going to touch it. They're going to leave it wrapped and bandaged. So they wonder why, how did I get it infected if I didn't touch it? I'm not taking a shower. So how's it getting infected? It's the person providing the care. That's what you got to watch out for, TikTok. The person who's providing the care, that means the dialysis technician or the nurse. And we're going to get into that. They should be washing their hands. They should be covering their face with the mask when they're cleaning it. They should be changing their gloves. And a lot of times, kidney warriors, they sit back and they just want to get their treatment and get out of there. They're not really paying focus on how the person is hooking them up, what they're doing. Are they doing it right? Are they doing it wrong? Is it normal for somebody to, take the dressing off and then walk away while this is exposed? And they walking around looking for something with the same gloves on, going in the supplies and getting it, and then coming back over with the same gloves, tearing the stuff and cleaning it. See, what you may see is not always right. Just because people are doing something the same way each time someone goes into dialysis, and you see them doing something, picking something up from the floor with the same gloves and not taking those gloves off, that doesn't make it right. Give me your thoughts, Brother Moses, of what I just talked about, especially with this catheter, because
absolutely
a lot
true.
of kidney warriors have this. Go ahead, brother.
Absolutely, Steve. Normally, what happens when it comes to the use of gloves? Well, they use it, but wrongly, in a wrong manner. Because, Brother Steve, for example, I want to show you a scenario whereby a nurse technician goes and handle a particular machine, then comes back with the same gloves on, and then maybe he wants to mute machine or anything he wants to do on the machine with the same gloves. Then using those gloves is not important and efficient. This normally arises whereby most technicians operates on a comfort zone. I've seen many, they come in dialysis unit, newly recruited, they are very keen, but thereafter a short period, they lax and they don't care much as they used to care. So it is very important for a patient to be educated, so that he can correct or remind the technician that, oh, no, these are the same gloves that you were using on the other side, and now you want to use it on me. I think it is simple as such. the best practice, which I believe in, is one glove for one patient. One patient, one glove. Thank you, Brother Steve.
Okay. Before I move on, I'm just going to talk about some statistics that impacts Black and Hispanics here in the United States. And this is data from multiple national databases collected between 2017 and 2020, and they are appalling. They estimated that potentially deadly Staph aureus, which is a bacteria, occurred in 4,751 of every 100,000 Black patients receiving hemodialysis, and 4,500 of every 100,000 Hispanics patients, compared with 3,866 of every white late-stage kidney disease patient receiving these treatments. So basically what I'm saying, Brother Moses, here, deadly infections impact Blacks and Hispanics more than they do whites. But again, they impact all, but just certain races or groups more than others, but they're still impactful. And like 40% of the infections were resistant to treatment. And that's basically MRSA, methicillin resistant Staphylococcus aureus, which is a bacteria that's resistant to a certain penicillin. So, Brother Moses, let's talk about prevention, because that's what we're here for, to prevent people on dialysis from being impacted and why it's important. And so, again, infections, including those affecting the bloodstream, are the second leading cause of death among dialysis patients. The second leading cause. That's why this broadcast is important. The first leading cause is cardiac. The second leading cause of death among people on dialysis is bloodstream infection. That's why this broadcast is important, because you're not going to get this information as we talk about it anywhere else. No one else on social media is sitting down trying to explain the importance of infection prevention among a group of people who receive life-saving treatment every other day. There's no other broadcast. And so if someone doesn't know what to watch out for, Brother Moses, or even think about infection, it's really not even thought about it until it happens to them. I'm sure that happened to you. Did you think about an infection before you got an infection the first time you received one?
Yes. I've had twice, two infections.
No,
almost in a span of 2 months, and it is not something that you really want. When you think about infection, you even become sick.
No, but you weren't thinking about an infection before you got it, correct? You didn't know anything about it the first time you received an infection.
I've been thinking about infection even before I had it. I was very cautious.
Okay.
So when I got infection, it's like I wanted to blame somebody, but I just decided to tackle that issue of infection. And it comes with hospitalization and bills and whatnot. And the second time also the same. Costly, really, it's costly. I don't know why. Is it costly over there in the US?
Oh, absolutely. And in fact, listen to this. Infections that are acquired in dialysis units can kill, disable, hospitalize, and or prolong illness in patients while disrupting lives and increasing the cost of treatment. For a lot of people that may get an infection, they may not recover as quickly, and that can linger on. How did an infection impact you, Brother Moses?
Steve, I got serious chills, and I was in serious pain all over my body. I couldn't sleep. The first day I was unable to sleep. So they did some medication and I got well. I stayed in hospital for about 1 week. And then it's good. I managed to come out. But I was affected financially because I had to squeeze whatever little I had to put up the hospital bill. So it was not easy. Actually, it is draining, both financially and mentally.
Oh, I agree with you, Brother Moses. And again, let's read down to some of these pointers that impact patients, pertaining to infections. Dialysis-related infections can occur in many body locations, including the bloodstream, bones, lungs, and skin. But as we talk about the bloodstream, when you have patients that get punctured with these needles, right? I'm going to show you here with these needles. This one is a 15 gauge fistula needle, and it's going in the skin. And if they're not cleaning it correctly, because we all had germs on our skin, we just can't see it with the naked eye. Okay. And if someone's just take the alcohol and swipe it once, that's not really clean. And so when you get repeatedly stuck and say if they're not covering the site with a gauze, they just putting the tape over it, that makes the person more prone to be at risk for getting an infection, because the germs can go right into the bloodstream through the needle entry. So that's very important. Also, there are many people want to know, well, list some reasons why this is happening. And there are many reasons why patients receiving dialysis have a high risk of infections, including the close distance of patients to each other. Because it doesn't have to be a bloodstream infection, it can be a viral infection. An infection is an infection. So, when you go in dialysis centers, I'm not sure how it is in Kenya, Brother Moses, where you have patients sitting in a chair right next to the proximity. Some may be further, some may be closer. And now with the, they kind of lowered the what? It's pretty, let me just say this. It's got lax now here when it comes to COVID prevention, wearing masks. All that is pretty much gone away to a certain degree. Now you can walk in hospitals. If you want to wear a mask, you can. It's not mandatory. And so the restrictions, that's the word I wanted to say, the restrictions have gone way down. And so with that being said, you're back in the dialysis unit. And if you don't have to wear a mask in the dialysis unit, I'm not sure. Well, yeah, we do, because I work in there. But you have patients who may cough, take down their mask, and we right back where we started. Now, what about in Kenya, Brother Moses? How close do each patient sit next to each other?
Actually, Brother Steve, it is so close, especially units where the units are not set within the hospital facility. There are given units that they are purely enterprises. So they are put in a given floor within the building, and even patients are huddled, they are squeezed in one small room. And then sometimes they do not even have the bathroom. They share the bathroom with maybe the common bathroom used within the floor, that floor, be it second floor, third floor, So
the staff and the patients share the same bathroom?
Sorry?
You said the patients and the staff share the same bathroom?
Very true. They share the same bathroom. You realize that the same bathroom used by the patient or members of that unit, including the staff, they share a common bathroom that is outside, but within the floor, be it first floor, second floor, and these are very common in cities. So because patients do not know all what we are speaking about, they don't care. They only go in, take their 4 hours, out, go home. Right, Steve?
Wow.
Yes.
Wow. And see, that could be cross-contamination. Because if someone used the bathroom, say, for instance, it may have, let's just say, hepatitis. Or, I talked about that in past broadcasts about cross-contamination, especially here in the United States, where, like, when somebody goes to dialysis, and like the door handle that you open to go into the facility, into the building, then the door handle that goes into the treatment room, or the door handle that goes into the toilet. It's not like, people are wiping those handles off, and you got hundreds of people each day touching that door handle. You don't know if they wash their hands or not. Even going into the bathroom, touching the door handle, you touching the door handle. Then you go out and you eat, touch the door going into the restaurant or wherever the case. Like I said, the days of the hand sanitizer and to prevention, it almost seems like it's gone out the window. But when you think about dialysis unit and the many people that come in and out of it, and they touching the door handles, and you go in and touch the door handle, you're not thinking, washing your hands when you get into the building, that's a form of passing germs. So another reason why patients receiving dialysis have a high risk of infection is the fast patient turnover between dialysis sessions. I don't know how it is in Kenya, Brother Moses, but here, when you got people coming off at the same time and the other shift coming in, it almost seems like a hurry up type of environment. This hurry up, wiping down chairs.
Very true. I agree with you. This is why I hate second session, because you would see something that you don't want to see. I mean, if you are watching and you are a patient, I would really advise you to make a priority first session, because just like the way Steve says it is basically a hurry session. People want the staff want to hurry up to fix in the machine so that by this particular time they are finished and they are going home. You know, their main business is the traditionally to put you in the machine and finish your 4 hours. I don't know, yes. Brother Steve, how long should the machine clean itself before a second session? How do they call it?
No,
maybe from one patient, then before the next patient, how is the cleaning or sanitizing the machine works? I don't understand that, but I see a lot of mess in it. It's really full of mess, Brother Steve, when we are talking about infection.
No, here, what happens once the patient comes off the dialysis machine, we strip the machine down of the lines and the filter, discard it in the red basket. Then we clean the machine with a bleach solution rag. It's a percentage of bleach and water mixture. We wipe the machine down, and then we set it up. And then we put the machine in test it. And that's pretty much it. The disinfection of the machine, as far as the internal parts, come at the end of the day when we bleach the machine. But they bleach the machine once a week. So, but when I'm talking about the turnover, you have some units that they put them in a position of like a hurry up state where they may move a patient may be bleeding. They move them out of the section and put another chair there and tell the other patient to come on, and they start working on them while they leave the other patient sitting there with the clamp on or holding their site. And then this is where the part for the infection passing the germs can come into, where someone may be working on somebody and then they may forget to change their gloves or not change their gloves and then move to the next patient and tape them up. Or they may change their glove and not put any hand sanitizer on or wash their hands. I mean, there's so many, what's the word I want to use? There's just so many ways that one can pass that? Oh, opportunities. There's so many opportunities where one can get an infection, where you got patients coming in and patients coming off dialysis, and you're trying to take off one patient and then at the same time trying to work on get someone else on the machine as well. Also, patients that are on dialysis, their immune systems are very low and have poor health, which is your immune system is low. It's going to be hard to fight off an infection if one invades the body. Have you experienced that? And we know you experienced having infection, Brother Moses, but do you agree about your immune system?
Absolutely, I do agree, because I've even experienced at times whereby I must watch out my drinking water. Sometimes when I take certain water from a given source, then I can experience some running stomach. I don't want to call it diarrhea, but it comes and goes. Yes, very true.
But, yeah, and basically the immune system of patients with chronic kidney disease often does not work well, which impairs their ability to fight an infection. So that's why when you see, if you got a catheter, and you start to get one of those symptoms, as Brother Moses says, chills is one, high temperature, redness around the site, maybe discharge or drainage, then we're going to give you an antibiotic while you're on the machine. And hopefully it will knock that out, that infection out. But the after effect, I'm sure one will feel maybe tired, malaise, weakness, fatigue after having an infection. Did you have any of those symptoms, Brother Moses? Like tiredness, weakness?
Very weak. I became very weak. And so I also experienced some kind of loss of memory. I could not remember simple things. Yeah. Memory loss was something I experienced. Yeah.
All right. So let's talk about what our brothers and sisters, the warriors, can do to help prevent from getting an infection, because that's the important part here. Even the statistics and all that is important, because it lets you know the people that are impacted by bloodstream infections a lot. But let's go down some tips on what people can do. One, if you got a graft or a fistula in your arm, clean your fistula site with soap and water before every dialysis treatment. I cannot stress that enough. When here in the U.S., they have sinks near the scale, or you can go in the bathroom. Okay? Make sure before you go on dialysis, before they stick that needle, to wash your access with soap and water, because they may not clean it as well with the little alcohol wipe. You just never know. They may have one or two wipes and do the strip like that and throw it away and then put the needle in. And that's not really the proper way of cleaning the access. And a lot of patients don't know that. You go into dialysis and you leaving it up to the professional, banking on them to do what's right. And what may look right to you may be wrong. And so that's why we do these shows. Because what they may be doing, you may think is right. The person come up with one strip of alcohol and go back down, where technically you're supposed to go in a circular motion, starting from inner to outer, moving the germs away from the site where you're going to stick, not putting the germs back and forth on the area where you. So this is serious, because when you're about to stick needles in your arm, okay, excuse me, when you're about to stick needles in your arm like this, you want to make sure no germs are going into your bloodstream. What are your thoughts about that, Brother Moses?
Oh, yes. And this show is really important. Why? Because, Steve, just as you've mentioned, what some of our technician does, they know the right thing, but they're kind of working in a comfort zone.
Taking shortcuts.
They assume you don't understand. Yes. They're assuming you don't understand. Maybe they are taking advantage that you have no idea. And this is why we are doing this show, to empower each patient, each warrior, and their caregivers to enable to have a better outcome when it's come to treatment. Brother Steve, I really agree with you. This is something just they would, even the manner in which they swap it off. When you swap and goes back like this, same point, already the germs is transferred back to the site. Or sometimes, very interesting. Yeah, this is why this show will empower you.
Absolutely. Can you hear me, Brother Moses?
I can hear you.
I froze up. So I just want to make sure you can still hear me.
I can hear you.
Okay. Yes. And then, Brother Moses, another important tip is to clean your hands with soap and water or waterless alcohol-based sanitizer before you start your dialysis session and after you leave. It's very important. Hand washing is very important. I cannot stress that enough. Hand washing is very, very important. I mean, with soap and water.
Very true. This is where patient must also be part of this journey, this treatment. It begins with them. They must also be accountable.
Absolutely. And if you have a catheter, wear a mask while the nurse is hooking you up. Make sure they're wearing the mask to prevent germs coming from the nasal passage, because we have staph right here in the nasal passage. That's why when you go to the hospital here in the United States, they do a swab. With some people, they do a swab their nose to see if they have MRSA. Also, if you have a permanent access like a fistula or a graft, discuss the early placement of that fistula before the need. Wait a minute, let me go back and repeat this. If you don't, so if you're on dialysis and you have a catheter, but you would need a fistula, talk to that doctor or surgeon before you actually get that done. And ask questions about it, because, again, you do not want to end up getting a bloodstream infection. Also suggested, not by me, but CDC and even other medical practices to get the flu vaccine every year, get the hepatitis B vaccine. Brother Moses, do they offer the hepatitis B vaccine in Kenya?
Yes, they do at your own cost. They do.
Oh, at your own cost?
Yes, at your own cost. It is available. I've taken hepatitis vaccine.
Brother Moses, didn't you mention to me one time that at your clinic they used the same solution from another patient to someone else? Are you still there, Brother Moses?
I'm there, but you are frozen.
Right, but can you hear me?
I can hear you now.
Yes. Did you mention to me that they used the same solution for another patient with you at one time?
Yeah. The solution bath, the dialysis bath. Yes.
Reason why I say that because the next
all in Kenya.
Say again, Brother Moses.
Almost all dialysis in Kenya, all the dialysis units have been. They when it's half, they can take that half, mix with another half from another patient, and put on the machine, and another patient gets and use it. I don't know whether it is the best practice, Brother Steve.
Okay. Brother Moses, stand by. We're having internet connection issues. In fact, the live has stopped. The broadcast is still going, but the live has frozen for YouTube and Facebook.
Okay.
So give me 1 second, brother.
Okay.
Let's see what's going on. Brother Moses, I'm back. Can you hear me?
I can hear you.
Okay. Yeah, we had some internet issues. So what I was asking you about that solution, because the next tip was, if you will receive intravenous fluids, request that they do not use the bag for other patients or set up the intravenous tubing until they are ready to administer the fluid to you. Also, notify a nurse or a doctor if the area around the central line, talking about this central line, if the area around where it goes in is painful or inflamed, secreting pus, or if the bandage becomes wet or unclean. Have you experienced any of that, Brother Moses?
Yeah, I experienced some tenderness around the catheter, and the skin when I had infection.
Okay. Now, also, if you got a catheter or even a graft or fistula, seek medical attention immediately if you develop symptoms such as fever, uncommon fatigue, loss of appetite, nausea, vomiting, and or changes in mental activity. Sometimes patients on dialysis do not develop a fever when they have an infection, so all symptoms are important. You may not get a fever, but you may have other symptoms that I just mentioned. So you definitely need to pay close attention to those symptoms if you have a catheter and or graft or fistula. And these symptoms just come out of the blue. And you say, what symptoms? As I mentioned before, fever, uncommon fatigue, loss of appetite. Just all of a sudden, you ain't have appetite no more. Nausea, vomiting, or changes in your mental status. You may have an infection brewing. Also, this is something that patients can ask if you're at dialysis. Before receiving, and if you got to get an injection, like in your arm, like a flu or pneumonia, but before receiving an injection, ask if the needle and syringe have been newly opened for you, since syringes and needles must be used one time only. You never know. See, we're only supposed to use a needle one time, but you just never know the intentions of someone. You just never know. Also, ask, I never seen this, but because patients don't pay attention, a lot of them don't, but ask if the dialysis staff put a new external, it's a transducer, it's a filter. In fact, let me show you what I'm talking about, if I can excuse myself. It's this filter right here, Brother Moses. Hey, Calamita, it's this filter right here that goes on the machine. This part fits on the machine from the back, and then the line fits in here, and it monitors pressure, like the venous pressure, and there's one for the arterial pressure. Now, sometimes the line that goes into this blood gets into it. And if blood gets into it, it can impact, go through the back and into the machine. So, as I was saying, ask if the dialysis staff put a new external transducer, which is this filter, on a dialysis machine for every patient, and replace the filter when it is soaked with blood. Again, many patients don't even think about looking to see if it's soaked with blood, but a lot of them are. This prevents blood from contaminating the inside of the dialysis machine and prevents patients.
Hey, Steve, just wait a minute.
Excuse me?
Yeah, this is the filter that is normally, it looks like that part of the sensor of the machine.
Right. It goes, it hooks on by the venous chamber, one by the venous and one for the arterial, and it monitors the pressure of the needle or the catheter, the blood coming out of the red side and the blue side.
I get you.
And sometimes the line that goes into it has blood because it's blood in the chamber. And that's why I had pictures telling if you got blood in the chamber to have them lower it so the blood can pour down. But again, a lot of patients don't think about this. They just want to go to dialysis and leave it up to the staff and then go home. But this kind of small stuff like this is important to people who want to, make sure that their treatment is not impacted. So it's little stuff like this. So that's why I wanted to show people, because I'm reading something about a transducer and I want them to put, an eye on what I'm talking about. And this sticks out from the machine. You can see this. If you look on the machine, you can see a line that goes right into this part right here. So also you can ask, but they normally do this each month, but you can still ask this. I'm not sure in countries over in East Africa, but ask if the water used for dialysis is routinely tested for bacteria. And but there are, here in the United States, they have to test the water each month for bacteria growth. And they only allow a certain amount of bacteria to be in that water. And you can also ask if the person taking care of you received the flu vaccine, because the healthcare worker can pass on an infection to the patient.
Oh, yes.
I seen it. You had a staff pass on COVID to a patient. And so when you go in for dialysis treatment, you definitely want to make sure or ask, hey, have you had your flu shot? Have you had your COVID shot? Because you're a customer. You want to make sure you're not impacted by the staff as well. Again, your immune system is low. You can't afford to have someone at work that's sick that should be at home in a unit working because they don't have enough staff. Also, what patients can do, and you, Brother Moses, you can pass this information on to fellow warriors in your clinic, and hopefully if other people are watching over in East Africa, they can, implement this as well. And that is, you can observe for a check to see if dialysis staff have cleaned their hands before and after they touch you or the dialysis machine. Anyone can observe for that. Once after they put you on, see if they go take off their gloves and go to the sink and wash their hands or use hand sanitizer, or see if they just, after they finish working with you, take off their gloves and put on another pair of gloves and move on to the next person. Also, you can make sure your nurse wears a mask during the initiation and discontinuation of the treatment with the catheter. That means when they're putting you on and taking you off, that they have their mask on. Do they wear their mask when they're working with you, Brother Moses?
Oh, yes, they do.
Okay.
Yeah.
Also,
but not all clinics.
Really?
But in my clinic, they do.
Okay.
They wear a mask, but clinics, it is not a priority, especially those type of clinic I was telling you, purely enterprise, that they are keen on maximizing profit. The ones that are especially not in a hospital setup.
Okay. Okay.
Yes.
Also, something that I mentioned earlier, the literature says, observe if the dialysis staff cleans the skin of your fistula well with an antiseptic before hooking you up to the machine. Again, a piece of alcohol going up and down doesn't constitute being clean well. You got to really alcohol, at least 4 pads. We got these big alcohol pads like that. I use 4 of them when I'm cleaning the skin. 2, I'm going from inner to outer. The second one, inner to outer. Again, you got some people just use 1 or 2 pads, strip, almost like the Karate Kid, wipe on, wipe off. And so that's not really cleaning when you get ready to stick a needle such as this into someone's arm. So again, please be observant, ask questions, don't feel intimidated or afraid to say something, because this is your body and you have that right. Also,
very true. It's
also observe if the chair, the table, and machine are clean between each patient use. And that's what you was pretty much talking about, Brother Moses, about the whole disinfecting process between each patient. That not just the machine, but the chair, the table on the chair where they put the supplies on, all that is wiped down. The garbage, maybe the garbage can changed. Some places changed. The patients have a little garbage pail right next to them. Some places change between treatments, some don't. How was it at your facility, Brother Moses?
Well, in my facility, they are doing their best. Almost,
I understand,
but I've seen
given the circumstances.
But other facilities that have been before, the situation used to be worse. Why? Because even the dustbin, which is being changed, it can be done close to the patient, right? The cleaning company staff just come, and their main business is to pick the bin and out without caring how they do it, because no one is in charge. Other clinics are very funny, Steve. Hopefully one day, if you come to Kenya, you will be shocked how sometimes I want to say most patients survive by the grace of God. Yes, very funny. The grace of God. Rarely you will not see them with any gown, just on their uniform, but no gown.
Right.
No mask.
Wow.
Okay? And they operate in a traditional manner, in that it is calm. How many hours? 3.5. How many hours? 4 hours. The machine is on. So the machine alarms, they just come and mute the alarm and disappear. Maybe go to WhatsApp or Facebook and wait for your 4 hours to go. Brother Steve, if you walk to other dialysis in Kenya, it is so pathetic. That is why I was telling, and this represent the entire East Africa. You know, Kenya is above other countries in East Africa when it comes to renal, because I'm not saying Kenya is providing the best. Brother Steve, understand. But then comparing us with other region, we are on top. But it doesn't mean that things are perfect, things are good. No. There are units that you will see and wonder how somebody survives.
Gotcha.
Yes.
So as we kind of wind down, let's talk about what family members or other visitors can do to help keep infections down. Again, hand washing, I cannot stress that enough, that hand washing or the use of alcohol-based hand sanitizer before and after touching something is very important. Very, very important. Wearing gloves and a clean covered gown to prevent contamination of clothing. All right. Keeping wound, if you got a wound, keeping that covered with a bandage is important. Also, avoid sharing personal items and clothing. That's very important. Again, I just can't
What about
stress
cutlery, brother?
I'm sorry?
What about cutlery? Sharing cutlery. How safe is it? The fork, spoon.
Oh, even that is important, not to share personal items like spoons, forks, items that you eat with. And I know over in certain countries that may have to be the case, but if you do have to share, definitely washing that item between sharing or sanitizing that item before sharing if you have to do that. But one thing about hand washing that's very important, that I can't stress that enough, because it says that washing hands is the single most important way to help fight the spread of infection. Hands pick up germs when we touch other people or surfaces like door handles. I mentioned when people go to dialysis, you touch the door handles inside the facility, the door handle to go to the restroom, into the treatment floor. You touch faucets. Got animals, may touch pets. So washing hands with soap and water removes viruses and bacteria that we cannot see with the naked eye. It's just that important. And so one may say, when should I wash my hands? And I want to tell you, wash your hands as often as you can, especially after using the bathroom. Very important. before touching or preparing food, after petting or touching animals, after sneezing or coughing, when hands are visibly dirty. And we see a lot of people out in public or at the clinic or wherever, when they sneezing, they don't cover their mouth. And if they do, when they sneeze in their hand, they don't, the average person don't wash right after or use hand sanitizer. So we got to think the way how we ourselves are impacting and spreading germs as well. If we're not practicing hand washing, hand sanitizer, or covering our face or wearing a mask or our mouth when we're sneezing or coughing, then we're just almost adding to the problem. Also, one of the correct ways of hand washing is first wet your hands with warm water, okay, and then apply the soap. Then rub your hands together for at least 20 seconds all over, back, inside, palms, back here in your wrist, between your fingers, under your fingernails if you got fingernails. Then rinse the soap off with clean warm water, and using a clean cloth or paper towel, dry your hands. And if you must use a lotion, use one, but we know certain lotions that attract germs. So you want to be careful about that. Brother Moses, are you still there?
There's Brother Steve.
Okay. All right. So again, if you're not near any soap and water, you can use hand gels or foam. Alcohol-based hand gels or foam is a good choice if soap and water is not available. You can buy these in stores. Just be sure you rub enough all over your hands until they are dry. However, you should use soap and water if you see that your hands are dirty. I mean, visible dirty. Anything you want to add, Brother Moses?
When it comes to hand washing, most of us do it also as a formality. So we must stress on the procedure, especially rubbing all corners of our hands. It is not just water and soap and you go away. No.
Absolutely. And when I was mentioning about covering your cough, many things like the common cold and flu spread through droplets in the air. Other more serious diseases like SARS and tuberculosis are spread the same way. And so it's important to cover your nose and mouth with a tissue when you sneeze or cough. Covering your cough reduces the germs that go out into the air. Okay? Be sure to throw the tissue away in the wastebasket and wash your hands or use an alcohol-based hand cleaner. And one last thing, let's talk about infection prevention in the dialysis unit. Just standard precautions. One, dialysis staff members should use caution to stop spread of infection. It definitely starts with us, the staff. So staff members should wear gloves, masks, face shields, and gowns when they are putting on patients and taking them off the dialysis machines. Staff members should clean their hands every time they enter and leave the dialysis station. Also, you can remind dialysis staff to clean their hands if you don't see them do it. If you don't see them doing, they just finished doing something. Hey, man, you need to wash your hands. Okay, the equipment in the station is clean with a special solution, pretty much bleach and water, to prevent the spread of disease. Also, all the chairs, and again, the bedside tables and the machines clean between patients. So, and then most units have an isolation section. Now, some medical conditions require patients to dialyze away from other patients to prevent the spread of disease. Patients may dialyze in an isolation room or an area away from other patients. And that's, if you have these diseases, you need to be in isolation. Hep B, Delta hepatitis, tuberculosis, and C. diff. And sometimes if you got C. diff, they'll put you on the last shift or at the end of the loop. Just remember, not every patient who dialyzes in an isolation room has a serious condition. Some dialysis departments need to use the isolation room for regular dialysis patients as well. So, Brother Moses, we're pretty much over the broadcast, an hour and 10 minutes. I mean, we talked about a lot about
Really, we've talked a lot.
Prevention. I know it was a whole lot of information, but I think it was some great information, especially for patients newly or recently starting outpatient hemodialysis. What are your thoughts?
Very true. And this show is very important also to newly in caregivers who are coming with newly in dialysis patient, because they are also part of this journey, Brother Steve.
Absolutely, absolutely. Do you have any departing words before we end our broadcast?
Oh, yes. Dear warriors, caregivers, and anybody else out there who has loved ones,
Did we lose you, brother?
Sorry?
Did we lose you?
I'm in.
Okay.
I'm in.
What was you saying?
Well, to all newly dialysis patient, caregivers, and anybody else who have a loved one on dialysis, this is a great show. Take your time and watch it. You are able even to watch it later.
Okay. You're right. You can always go back and watch this broadcast, even though the technical difficulties, you can still hear us. So with that being said, Brother Moses, we appreciate your time as always. Take care. I know you said that it's raining in Kenya right now. This the raining season.
Oh, yes.
So we definitely appreciate you taking the time coming on. Want to thank the people who joined watching us on YouTube and Facebook. NG, hello. Thank you for tuning in. P. Teach, thank you. Don Kirkowski, thank you. And Don also said, hello, Moses. So someone sent their
hello
greetings to you, Moses. Don Kirkowski.
Hello to you. Hello.
Okay. So with that being said, we'd like to thank everyone for watching, and join us next week, next Sunday, for another broadcast of Kidney Hub East Africa. Now, we may take us a while to get out because our screen is frozen. So bear with us, Brother Moses. I'll talk to you soon, and take care of yourself.
Have a great day, Brother Steve.
All right.
Thank you for the show.
All right. You're welcome, brother. We're kind of frozen.
Oh, but I can hear you clearly.
Yeah. If you want, you can sign out, but I can't do anything because of my screen is frozen.
Okay.
Question. Okay. I want to answer this question while this is going on. If you want to stay on board, you can, Brother Moses. Question. I really want to relocate outside of the U.S. Are you still there, Brother Moses? Do other countries do PD? I'm not sure. Brother Moses.
Oh, yes.
Wait a minute. Do they do PD in Kenya?
No, it is not there.
Yeah, I don't think.
Still planning it, but yeah, they are planning it. It is still not there.
Okay. Now, I'm sure other countries do, like the UK. Yeah. I'm sure the UK, but you just want to be careful with your supplies. And when it comes to picking your doctors and everything like that, because I'm sure it's a whole different healthcare system over in other countries. You say they don't.
And I don't know why most African countries do not want PD, and
it could be the infection rate.
It has the most infection rate.
No, I didn't say that. I said it could possibly be, because
okay.
You know, with PD, you know, with the sweating and the hot sun over there and how it gets hot, I think it could possibly be a problem because of where the PD catheter is located.
Oh, yeah. But
So-
if patient, I believe, if patient get educated properly and knows that this is life and death, you know, Steve, we must put it clear that way, that this is life and death, then I think patient could be more cautious than dialysis technician, because patient will be working knowing very well that this is my body. No opinion.
Absolutely.
Yes.
All right, Brother Moses, let me go ahead and shut down while I think I got the opportunity